everyone, and welcome back to Joy Beyond Dentistry. Quite a pleasure to have you with us today. I am Ramon Duran, together with my co-host.
Noemi Cruz Orchid. Welcome.
Great to have you. Great to have you back tonight. And tonight we have again a very special guest, an international expert in wellness and performance, Dr. Uche Odiatu. How are you, Uche?
No, I'm great. I love sharing with my colleagues. This is one of my passions. Besides doing composites, second thing is wellness, and then getting other people feeling what I feel when it comes to total health.
It was quite an honor to have you already before here, and we cover initially some of those areas that you love so much about wellness, overall health, fitness. And then on our second occasion, we talk a little bit about how to start our days. And tonight, we're going to talk about how to finish our days, what kind of a routine we could practice to the end of our day. We know that in Joy Beyond Dentistry, in order to perform to our best, we need to take proper care of our minds, of our body, and that's one of the things that will make us a joyful person. So here we go. Uchi, welcome back. Great to have you again.
Yeah, it was a pleasure. It's in terms of there's some things that people do naturally, and I just assume that everyone knows. And then you'll talk to someone beside you on a plane in business, and they're completely unaware how they can have certain habits that help them do what they do better. And most people think in order to get better at work, you have to learn new clinical things, or you got to get certified in certain procedures. But if we simply hacked into our physical body, our mental body, and spiritual body, we can actually become more productive and have a more fulfilled experience in this whole life that we have.
Absolutely. And you know, I love how you put everything together and how you actually last time focused so much on how to start the day with intention, with what habits, what different nutritious foods we can have to start our day with a clear mind and being productive, right? Not just at work, but in general as we move, as we go about our day. And for those that haven't heard, listened to that podcast, listen to it because there's a lot of great tips that are going to help you get the day started. And so having you back and listening to now, I'm so excited to hear about how do we end the day to get a well rested, you know, night of sleep, which makes a huge difference as how we wake up the next day and start our day and how productive we are. So cannot wait to hear about it. And thank you for sharing your wisdom because like you said, we assume that those are common sense, but they're not, and they make a big difference. So we have to make more awareness of it to be able to live with joy.
So there's several things that I do naturally, and then some things I've studied and added to, and usually it's basically a lot of it's from neuroscience, and also exercise science, and probably also nutritional science. So in terms of starting, we can almost start with food because every time people say, why do you look like the way you do? How do you have the energy you do? Is about what's your diet? One key element that if people wanted to start doing this evening, because one of the best things you could do is when you learn something new, do something about it right away, because then your brain assumes if you're not going to take action on something that you just learned, it's not that important. So we could start with nutritional science. And what they've shown is if we have a meal, we're not talking about an apple, we're not talking about water. We're talking like if someone has a meal within 2 to 3 hours of bedtime, our body spends that time digesting food. And digestion is one of the highest demanding energy processes our body uses. So our bodies would rather have very much almost a fairly empty stomach before bedtime. It's not that you have to go to bed hungry, but you want to not eat within 3 hours. So if you go to bed at 10, it would be 7. If you go to bed at midnight, that would be 9 p.m. So it doesn't really take a lot of Spartan resolve. But if we eat a meal before bedtime, what happens is the body spends less time recovering, replenishing, and repairing. So with dentistry being as intense as it is, we often, even though people think all we do is we make our money doing this all day, what happens is it's very physically demanding, emotionally, physically. Our backs, our our posture, our 600 muscles take a beating. So that repair is not as good if we have a meal before bed. So I think of any dentist uh, who has a postural issue or a joint issue that's not getting better, look at how much food you're eating within 3 hours of bedtime. And you might think go to bed with a little bit of food in my stomach is good for you. However, it will actually, your body will spend more time digesting food than repairing or recovering from a sickness or an illness, or it's been a very busy day.
Very interesting point. Super interesting. So going to bed with kind of an empty stomach, 3 hours before bedtime should be your
And that's
last meal.
And that would be ideal. If someone wanted to have an apple and some nuts or some kefir or some yogurt 2 hours out, not a big deal. And again, depends how big you are. If you have a 240-pound dentist, a small bit of yogurt and nuts is very different than a 110-pound dentist eating some yogurt and nuts. So the whole idea is no meal, like a dinner meal, within 3 hours of bedtime. And part of that process is my brother's a police officer, retired now, but they always talked about the biggest thing people do when they come home for a shift as a police officer, and then they want to go to bed to sleep. What happens is don't eat, even though you haven't eaten. They don't want you to eat within 3 hours of bedtime because you have more chance of reflux. And look at how many patients have GERD, gastroesophageal reflux disease, which is not just an esophageal issue; it's a tooth wear issue. I know Noemi do a lot of big cases, so this flattening of the cusps now, after a decade of eating before bed and silent reflux, it changes people's bites. They lose vertical dimensions. You start seeing this because aesthetics concerns, like a face collapses because of silent reflux and the cusps losing some of their height. So besides not repairing, not recovering, not recuperating, people actually can lose vertical dimension from the reflux that happens. And people think, oh, I don't have reflux, but you can see the telltale signs by the rounding of the cusps and the dished out cupping that happens.
Totally. Yeah.
That's a great point, and we have so many patients that do have acid reflux for different reasons, and that's good to also make them aware of, right? Like it's like, how are you eating before you go? Are you going to bed, or what are your habits before going to bed, nutritional wise? But also, you hear the trends out there about eat 2 kiwis before going to bed, 1 hour before to bed, so you can get the serotonin and the melatonin that you need to have a restful sleep. Like, what is your take on that?
I haven't heard that one. I know there's lots of little new things that pop up, and that a lot of nutritional advice comes and goes. So, if someone's only problem to get into bed is they don't have enough kiwis, I'm thinking, what's your emotional state? What kind of loose ends do you have? Is your room? We get into light and dark cycle, but a kiwi. I've had people come up to me after a seminar and say, "Hey, I take a half an Ambien before bedtime. What do you think of that?" I'm like, so people are taking, people take hardcore sleeping medication to sleep, and so a kiwi would be a safe way to support, serotonin and melatonin. But ultimately, I think if you want to get now into, prescription over-the-counter medication and sleeping pills, the current neuroscience says that there's no such thing as a sleeping pill. They're actually sedatives. There is no sleeping pill. They sedate you. So what they do is they shut down your prefrontal cortex. And that's why people with a sleeping pill, when they have 7 hours sleep, it's not rejuvenating. All they've done is they've had their eyes closed horizontal for 5, 6, 7 hours, but they don't actually sleep. They're actually sedated, and that's why you don't wake up from general anesthetic feeling great. So we're going to talk natural ways to sleep better, other than over the counter and prescription. But I have people asking me about taking cold medication, some of those sleepy cold medications. And if you're taking a sleepy cold medication 3 or 4 nights a week because of a busy day or you're stressed out, probably not a good thing for your nervous system or your physiology to be dependent on over-the-counter cold medication. You'd be surprised what I get asked. And so there are people, just because they can't sleep well, will take an over-the-counter cold medication once in a while. But hey, 2, 3 nights a week, what's the problem going on?
And they will alter totally your sleeping patterns. And as you said, you're not going to be sleeping well. You're not going to be resting well. You're not going to be recovering properly because everything will get altered in your sleeping cycles.
So if you want to just a quick summary, because I know repetition is the mother of skill, is no meal within 3 hours of bedtime, 2, prescription sleep medication, and over-the-counter cold medication, the drowsy kind, is a poor substitute for having better sleep hygiene. So I'll hear really smart people telling me, "Oh, I'll take some cold medication before bed to take the edge off my day." So the best bet would be to have no big meal in your stomach, so your body actually spends more time repairing. But think of all the joint issues that people have, like from tennis elbow, bursitis, a frozen shoulder, knee pain, hip pain. If someone's just had a knee replacement or hip replacement, if you eat before bed, your body will spend less time repairing. So we're not just talking about sleeping deep, we're talking about what's not repairing. Aging. Think about it now. Slowing down aging and repairing our skin and collagen and everything else at nighttime and building muscle. If someone's eating before bed consistently, they will have accelerated aging. If you want to extrapolate, your body will spend less time repairing and recovering because it's busy digesting food. So you can see the wide impact of having that 3 pieces of pizza before bedtime, or the pizza in the meal. And again, once in a while, big deal. It's your birthday, it's late, you want to go to bed after. But if it's a nightly affair, less recovery, less replenishing, less healing after an extraction. Think of our post-operative instructions after a connective tissue graft or an implant. Don't eat within 3 hours of bedtime tonight. And you can get the patient knowing that we are, they say the word dentist, it comes from the Latin word doctore, a teacher. Don't eat within 3 hours of bedtime, because the body spends the sleep time recovering, replenishing, and healing. And people often say, I did not know that, because people think we're healing all the time. But healing goes into high gear at nighttime. That's how our immune system goes into high gear. And I think some German immunologists and researchers talked about during the daytime, our immune system's in neutral or standby mode. It goes into high gear at nighttime. So our immune system is less able to go into high gear if we have a meal before bedtime. And it sounds like we're flogging a dead horse, but if someone has a cold, if someone has pneumonia, if someone is going through a decade of hardship, or their job is tough on them and they're looking road weary because of higher cortisol, you do not want to eat within 3 hours of bedtime. So again, to flog a dead horse, but again, that's almost a basic one. No one's going to sleep deep after a meal before bedtime.
Also, what about a nightcap before going to bed? We hear that a lot. It was like, I'm going to have a little whiskey before going to bed so I sleep better. But similar
That was
to prescribed
that was going to be my question.
medications,
Yeah.
it's like it's, the recovery sleep, the deep sleep, the REM sleep, it's impaired during that time.
So that alone, and again, this nightcap, we see it in movies. Celebrities have made it very popular. Birthday parties, nights out, Vegas, girls' night out, guys' night out. That alcohol within a couple of hours of bedtime. They say within 3 hours. Again, I'm guilty of that occasionally. But again, I will have an impaired night's sleep. And it's not just you won't sleep as deep. You got to think what goes on. Lower growth hormone, lower testosterone, lower recovery, more challenges with menopause and other physiological changes, the natural transitions of life, because the body's not healing as well. But you talk about REM sleep, we need about 100 minutes a night is what the sleep experts say, anywhere from 90 to 110 minutes. So if someone has alcohol before bed, it shortens the REM sleep, which seems like, oh, I don't care, I'll dream less. But it's during dreaming, Matthew Walker, PhD, says, is that we process memory and we process emotion. So if someone's having a nightcap before bed every night, think of an alcoholic. Think of someone who just thinks a nightcap is harmless. And again, once in a while, dinner, 50th birthday, 25th anniversary. But that night, there'll be less dreaming, which ultimately means I'm not emotion as well.
Yeah, that was
Yeah.
exactly the point I was going to bring, because it has become like so popular. After a tough day, why not end the day with a drink, a glass of wine, and it's going to impair and alter totally your sleep pattern. So a point that has become stronger and stronger lately. So thank you for bringing that up.
And think of our dental job is so uh, intense and so complex. They said the more complex and stressful your job, the deeper your sleep has to be.
Alrighty, so we keep on. All right, so great 3 points. So first one, avoiding heavy meals 3 hours before, or avoid, I mean, going to bed on a full stomach 3 hours before bedtime. Second one, avoiding medication, sleep pills of any kind, cold medication to try to sleep better. The third one would be alcohol, so avoiding as much as possible because it will totally alter your sleep pattern, right?
Yes. So those things, and again, each one of them is powerful, because I do know people that take drowsy cold medication Any night they've had a tough day and they want to go to sleep quick. I know people before red eye will take some, I won't name the brand, but some cold medication. So, and if someone travels 90 days a year, 100 days, that's, that's almost 25% of their nights they're taking cold medication, which is not what it's meant for before bedtime. So they will have disrupted uh, uh, sleep cycles, and those sleep cycles, humans have been going through them for millions of years. That could be the accelerated aging. That could be why someone has jowl. That's be why they have chronic injuries. That's why their memory is poor. And I know very few adults that will say they have a great memory. Almost everyone you'll hear these days say, I am horrible with names. I am terrible with numbers. My little in my back of my mind is like, how are you sleeping? Oh, horrible. And or a patient will go, I've had this injury now for 4 months. It's not getting better. How are you sleeping? Oh, we just bought a dog and the dog is on the bed and it gets up twice a night. I'm like, talk about accelerated aging. How old is your dog? 2 years old. You have another 13 years of getting up twice a night and ruining your sleep cycle. Oh, we love our dog. Well, just know that having a dog on your bed, getting up twice a night, sometimes these spoiled dogs will want 3 times a night going out, and or they're barking with the snow removal machine going by. Whoop, whoop, whoop. And if now we're talking 13 years, so accelerated aging, poor recovery after a joint repair, maybe lack of ability to heal after an implant. And people don't realize the far implications of poor sleep on their aging, their youthfulness, chronic injury not getting better, uh, memory. But so what we're talking about is pretty powerful. You'd be surprised how patients have these questions, and obviously our fellow professionals have questions.
Sometimes you would hear people say, like, well, I have been having any I only sleep 4 hours a night and I feel fine the next day. And I have been doing this for years, or I've been having these habits for years. And, you know, and you wonder, it's like, yeah, you're functioning fine, but are you functioning how you would be if you were sleeping more, right?
Yeah, so the neuroscience says it's called getting by. People will never say, I feel amazing. They'll say, I can get by on 4 hours. It's like a dentist saying, I could get by being annoying chairside patients. Like there's getting by and there's thriving. So surviving on four is very different than thriving. And they said so few people can get by even with sleeping less than 7 hours, unless you have the gene HLHR1, so BHLHE41 gene. Every one of us needs 7 hours. So anyone that's not, even though they might be performing and living at a high level, they could go even higher by getting sleep. You'll never hear an Olympic athlete during the Olympics, I love getting 3 hours. Uh, when I look at all the top high performers, LeBron James, sleep is my secret weapon. Tom Brady, Serena Williams, Michael Phelps, Roger Federer, Usain Bolt, they all say sleep is my secret weapon. I've never heard a dentist say once, I'm a great dad, I'm a great mom, I have a lovely practice life, and it's all because I sleep well. So why why are elite athletes the goats of their in their sport say sleep is number one? You rarely hear people. I remember Einstein was quoted as saying he gets 10 hours a night. One of the smartest people in human history. So there's something to be said about performance, recovery, repair, and deep sleep. And few people talk about it. Few people have that as their go-to to perform better. I think some dentists say, hey, I have a big case tomorrow, I have a full mouth rehabilitation, I want to get 7 hours. But and that quality of sleep is definitely preceded by good hygiene. So again, no food within 3 hours of bedtime, no alcohol, no nightcap, and stay away from the cold medicine because you might feel like you're going to get to sleep quick, but it's a sedative. There's no sleeping pill that actually is really a sleeping pill. They're all sedatives.
So, in terms of, I mean, we also hear about exercise, right? It's like, oh, don't exercise right before going to bed because it raises your cortisol levels. And so, how close to bedtime is okay to exercise, and does it really affect our sleep?
Yeah, see, I think it's called a chronotype. Like I happen to be a night owl. They say 30% of adults are night owls, 30% are morning larks, 40% are mixed, meaning they can get up early if they need to, they can stay up late. So if my chronotype is I can be up later and still feel like I have energy, even though I could probably still work out at night. They said physiologically for hormone and muscle development and repair, I'm still better off doing a robust, aggressive workout upon awakening, middle of the day. And the exercise should be less intense after dinner before bedtime. And even though we can say, I have no problem going to bed after CrossFit, because cortisol is high, melatonin is low. So you might be able to go to sleep because you're exhausted, but you're going to have melatonin. And the other really myth is people think melatonin is simply just a sleep quality, but melatonin is involved in metabolism, immune system, recovery, uh, hormonal health, nervous system health. So it's not just a sleeping neurotransmitter released from the pineal gland. It's involved in almost every uh, physiological process in the body. It's incredible. And you can have your melatonin lower by 25% with cortisol being high. So working out intensely before bedtime. So that being said, what's the best exercise? Yoga, Tai Chi, a walk, but no sprints, no all interval training before bedtime. And people say, well, that helps me to relax. Well, just know your sleep quality is going to go down. So that may be the reason why your hip doesn't heal and your plantar fasciitis hasn't gone.
And what about Uche? What about taking melatonin pills themselves as a sleep aid, which is something that many people do?
Okay, a great question. I think people really would love that. Nothing wrong with them. However, Huberman says they're very little regulated, and what happens is melatonin's been assessed in the supplements. Some have anywhere from zero melatonin in them to 400% more than what you need. And so that alone should make you feel wary. Your melatonin could be zero, so you're doing a placebo, or you might be having 4 times. And when you start looking at how the body uses and releases melatonin, it's released in gentle bursts. Think of the pineal gland. It's not like boom, a big capsule of melatonin. It's gentle bursts, like it's been happening for 400,000 years. Homo sapiens has been on the planet for 400,000 years. So taking it all at once is like saying we need to drink 8 glasses of water a day. Can I drink them all at once? Like now it doesn't make sense. Or I breathe 21,000 times a day. Can I breathe 21,000 breaths all at once? So now you can see maybe I shouldn't take all the melatonin before bed all at once, especially if it has 400% more. So melatonin basically in supplement form, unless it's by prescription, you may have zero, you might have 4 times more. Another thing wrong with that is in our bodies, melatonin doesn't get released, 3 grams at a time, 3 milligrams at a time. It's done in gentle bursts. And that's why we're really messing up our body by having it all at once. And now you see when I talk about that all at once, it's really not meant to be taken all at once. It's like a hormone. Neuroscience, it's one of the few hormones you can buy in a drugstore without a prescription. You can go to none of these nutritional stores. Melatonin is a powerful drug, especially if you're getting 400% more. And you can buy it without a prescription. It's odd. And to give you how powerful it is, if you give it to a 10, 11, 12-year-old, it can delay puberty. To give an idea, all those parents that give a little bit to their kids think it's going to help them sleep. It delays puberty. And in men, it lowers testosterone. So think of a man already who we have lower testosterone with age. Think of a man who's taking melatonin every night. And now they're going to the doctor for testosterone replacement therapy. So you're taking melatonin every night, which lowers your testosterone, and you're taking testosterone patches, creams, and pills and injections. So it's really counterintuitive. So melatonin is a serious medication, shouldn't be taken lightly. You wouldn't want to give it to a 10, 11, 12-year-old because it delays puberty. And also, many times in the supplement form over the counter, it has zero in it, zero melatonin in it, and some pills up to 400% more. And ultimately, it's not released that way in our system because of the body does it in gentle bursts and mists out of the pineal gland, not all at once. Obviously, we're doctors, it makes sense. But what a great way to share with patients. You see a patient, when I ask them, what's your medical history, what medications you're on? Oh, I take melatonin. Now you can ask them, do you take it by prescription or over the counter? Oh, I get it at GNC. a nutrition store. Did you know it has anywhere from 0% in it to 400%? And that's here we are, doctorate, we're teaching, and I think and that's the value added about being a wellness healthcare provider. You look at patients from
Great, great advice. So pushing for 7 hours, melatonin is not a good idea because it's totally unregulated when it's not a prescription drug. And so, what else would you advise in terms of that night preparation as we come close to bedtime? What about lights? What about the? I mean, we're playing with the orange glasses as a filter. So, can you talk a little bit about lights and its effect on our sleep patterns?
yeah. So this whole concept of like I say, uh, every one of these is really important because you can sabotage your health by eating a meal before bed every night. Uh, Light is one of the biggest, and it's a German word. It's called Zeitgeber. Zeitgeber, I think it's spelled Zeitgeber, and it means a stimulus that causes a change in your body. So the largest stimulus we have that creates a physical reaction is our light exposure. And you think, how's that possible? I went to Harvard, I went to Tufts, I am a post grad, I went to Coice. No, you're still a human, and your biggest stimulus in your life is light, your light exposure. I think it says that 200 physiological processes happen in your body, and it's influenced by the light dark cycle. And it's not just us, it's worms, it's our bacteria also is influenced by the light dark cycle. So the whole concept is we're meant to have bright light first thing in the morning. And in the evening time, especially after sundown, you want less overhead. And it's the overhead light that duplicates the light of the sun. So if someone's eating before bed, having a glass of wine before bed, taking fake melatonin, okay, has a big dog on the bed, you can make your sleep even worse by having overhead lights on before bedtime. And you might say, I've been doing this for years. That's the reason why someone could have low testosterone. That's the reason why someone's hip never gets better. That's the reason why someone might have 4, 5, 6 millimeter pockets, not responding to a soft tissue management program. We never think of it. But if someone's not getting better and doing everything right, I would ask, hey, what's your nighttime routine? What, oh, yeah, the lights really bright. I have a kid in graduate school. I have a young puppy where you take it out in and out. Uh, you have pot lights, 20, 30, 40, 50 pots lights. You're sabotaging your sleep quality. And I don't think anyone ever asks about that. Think about it. When I give post-op instructions after surgery, do I ever say no overhead lights? Like I don't. Uh, but some good moms know. Some good moms know that already. You know, have the house dark. But how many people actually flip the light on and everyone's brain wakes up? And now, it's 12 seconds of light exposure sabotages your melatonin release by the pineal gland. 12 seconds. So I think this would be a major thing that someone could change. When people ask me, Uche, how can you do 20 chin-ups? How do you squat 3 plates? How do you do what you do? Well, I manipulate light a lot. It's one of the most important things I do.
Yeah, thank you for sharing all that. And it's like a lot of information just on, on this short period. But I mean, the recap of this would be exercise, right? Like if we're going to exercise, let's try to do something more relaxing, yoga or some not intense training right before bed. Being careful with trends that tell you, okay, if you take this medication, you'll sleep better, or even like foods that they might say like, okay, eat 2 kiwis before bed, and just keeping track of it might not be the right thing, and it's like what's the evidence behind it. And with melatonin specifically has been so popular, especially like you mentioned, even around teenagers or kids, and we forget that it's a hormone, right? Like it's just it affects other hormones as well. And then light, we're so exposed to it all the time that how do we the, control it before going to bed, as we are like busy during our days, and then we want to catch up at the end of the day, try to, we're using our computers, we're using our iPads, we're using our phones. So being mindful of all of that and still being productive and accomplishing what needs to be done before we go to bed.
But look at the people even driving home at night. Like, had a long clinic day. It's 8, 9 o'clock at night, wintertime. you have a 30-minute drive, you'll literally pass by 400 cars, all with headlights. That alone can sabotage someone's workout. They just hired a personal trainer for $90 an hour, bought an $8,000 mattress. They got the dog off the bed, not eating before bed. They cut out the wine, but you forgot the fact that you drive home 30 minutes in the dark with 400 sets of headlights. That's one of the reasons why truck drivers have such a hard time being metabolically healthy, because of the mega destructive effect of headlights on your eyes driving home in the dark. I think a truck driver, you know, 10 hours overnight, like they're literally giving away their health to live what we need. So driving, that's why those orange glasses, I'd have some clip-ons I put on my glasses, set in the glove compartment. I have a strategy, right? I have a set in my glove compartment. I have a set in my carry-on, and it's pretty serious. And even chair side, sometimes I'll put my little clip-on orange glasses in my scrubs, and I'd say at least a couple times a day, some patient will say I sleep horribly, or my husband doesn't sleep, or my wife doesn't sleep, or I've got this injury that hasn't gotten better. How do you sleep? Horribly. Keep your lights on. A teaching point happens, and that's that total patient health. Not just the three of us being super healthy, each other. Share side. I think patients appreciate a healthcare provider that looks at all of, not just looking at this one little area. Uh, and it's amazing how they trust you. And if you quote books, Why We Sleep by Matthew Walker, John Rattay's a book called Spark. Uh, there's so many books that talk about the value of sleep. Sleep Smarter by Sean Stevenson. Um, and they're on my phone, so I'll share with the patient. And I'm doing it with passion and conviction, and they'll understand. Dr. Odiatu, you're pretty serious about this. I've never been more serious. I might be doing 3 crowns right now. I just took an impression and I sent them off to the lab. I want your tissue to heal and look good before next time. I want you to have good sleep for the next 7 days. So there's so many ways we can work sleep advice into the chair, and that's value added. You become the patient's trusted advisor. They will never leave you. Stuff that they've never heard before.
Definitely. We go well beyond smiles and fixing decay. We can influence significantly our patients and be wellness health advisors and again looking at all over their welfare, their well-being. Uh, I mean, great points that we have shared tonight. And as we're coming to an end, I mean, and it's an amazing list what we got for today. 6, 7 great items. Anything else that you would like to add to our listeners tonight in that nighttime preparation to close our days?
Okay. Screen time. Screens are in everyone's conversation now, and the experts are now saying no screens within an hour of bedtime, which means no 8-foot TV. We're watching World Cup soccer, even though we're cheering on our favorite team. Or you want it muted, or if you really want to watch, Messi or Ronaldo or Erling Haaland, I would put orange glasses on. If you want to really be strict about that, if you have an injury that doesn't heal, if you have low testosterone, as a female, you're going through menopause. If someone's going through menopause and not managing life, someone's going through menopause is eating before bed. Someone's going through menopause having a glass of wine at the nightcap. Someone going through menopause has a puppy and put it on the bed. If someone has gone through menopause and has the room warm but too hot, if you have a night light on that's got a blue light, those are all things that are sabotage. And one of the biggest reasons is if you want to get metaphysical, joy beyond joy is the theme. There's a state called the hypnagogic. So hypnagogic state is the state where gamma state is where our brain is going through a crisis. We're in peak concentration mode. Um, Beta is what we're probably in now. Alpha is kind of a daydreaming, kind of being chill, enjoying a conversation, out with your romantic partner. So right before bed, as the brain waves are getting uh, uh, lower, what happens is called the hypnagogic state. That change from alpha waves to theta is called the hypnagogic state. And if your discussion with your partner before bed is positive, if you talk about hope and what your blessings are. That transfer from waking to light sleep can be a beautiful time. People have aha, people have lucid thoughts, solutions for problems they've never been able to have. So that word, and I love it, it just sounds beautiful, hypnagogic, hypnagogic state. The change from alpha, being slowly drifting off to theta, hypnagogic. And if you're doing all your sleep hygiene, cool, dark room, cool, no screens at an hour of bedtime because they're too exciting. That nightly transfer can heal some. Think of the childhood trauma that you can have that people can resolve. Think of uh, issues that people go over and over that they never get better on. That that transfer from waking to sleeping is really a magical time. It's a metaphysical time, and I think a lot of the greats in history, Edison, Isaac Newton, have used it to plant a seed to get a solution before bedtime. And your body simply can't use it if you just took a gallon-sized thing of melatonin and you're watching Cristiano Ronaldo on an 8 foot, plasma television. So there's value in having that nice, and then proceeding into the time that the body grows and recovers.
Yeah,
So the concept of the gratitude journal towards the end of the day would have a lot of value in getting ready for bedtime, right?
Well, that would be beautiful. It's a great way to review the day because our nervous systems are wired for pain and to avoid things. And we've all been there. We have 8 patients, 7 went well. Some patient at 1 o'clock said, "I want to leave the office. I'm not happy." That's the one we think about at night. And we think, why do I do that? Because our nervous systems are wired to avoid pain. So we are wired to think annoying things. So a gratitude journal, you're into your nervous system and saying, forcing you to think of things you're happy about. I'm alive to another day. I have a bed that's warm. I'm in a safe part of the world. I'm in a great industry. And now that gives you a better from waking to that theta level of sleep consciousness. What do you think, Noemi?
I am, I was gonna mention that it's like as we go to bed, what are our thoughts? Because that influences a lot of what our even our dreams are going to be, right? And then how we awaken and um, like you have mentioned, topics of nutrition, watching the activity before going to bed and the cortisol. What are we taking before going to bed in terms of medication or supplements? And but then also like how are we thinking, how are we feeling before we go to bed is I would think is probably one of the most important things as well, because as we think we create, right? And what are those thoughts before we are ready to rest, and then how do we awaken the next day? And we all know that we have had those times that we had gone to bed, something hectic happened, or we had a discussion or something that is had been in our mind. Our dreams might not be the nicest dreams, and then we wake up and we might be confused, but we know that something is not restful, right? So that
Mm-hmm.
practice, and as we our podcast and our topics is like around are all about joy, right? How do we maintain that joy? And having a clear mind affects how we think through the day, and sleep definitely affects how clear we are when we awaken. And then how are those thoughts influence about, depending on how well we're rested. I know I for sure I'm a little bit more irritable if I don't get my amount of sleep that I require, right? And that how does that affect everyone else around us?
Definitely. So that old saying that there's never a big problem after a great night's sleep. So something to keep in mind. Uche has been amazing again. That those last few points, I mean, cutting down on or avoiding the screens, I mean, and getting our orange glasses. So it's about time to do it. So as we come to to the end of our
I do
program
have
today,
mine.
yeah, yeah, we're ready to roll. Yeah, so thank you. It's always great to have you. Great advice in terms of how to finish our day, how to get prepared to have another great day. So thank you so much for your advice. It has been quite an honor to have you. We really appreciate your time. Thank you,
It's a
Uche.
pleasure. Pleasure. That last 3-4 hours before we sleep, you can really design a beautiful night, and that third of our lives that we all spend sleeping, healing, conflict resolution, emotional regulation, memory consolidation. We have more control of it than we think. And it doesn't have to be pharmacological or by supplement. We can really tap into the wisdom of our body, which is, I say, we are CVS. I have Walgreens inside me. And if I give it the rest and breath and darkness that it needs, I can churn out, hundreds of neurochemicals and things that will serve us. So, that being said, the human body is a miracle.
Amazing. Thank
Beautiful.
you.
Yeah.
Thank you. It's been really, really great, Uche. And to all of you, thank you for joining us to another episode of Joy Beyond Dentistry. It's always a pleasure to have you with us. Uche, thanks so much. We look forward to have you again in the future. It has been amazing to have you with us.
It's always a pleasure, Ushi. Thank you again. And remember, joy is a choice.
And good night. Sleep tight.
Good night. Yes.